So sorry about my voice. I'm getting over a cold. But anyways, I am making a video because today is Tuesday the 13th, and coming very closely, the day after tomorrow is Thursday the 15th. And on that day, I will be getting this knee right here cut open and fixed. So anyways, I am having an arthroscopic lateral release done on my left knee, and I will show you really quick, if you can see it here, that my kneecap is on the outside of the knee, so the bones here rub together, which causes a lot of pain. So the surgery is that they're going to cut the muscle or the ligament right here on the outside of my leg so that the kneecap can then hopefully go into the right spot where it's supposed to be, and it won't rub anymore, and that'll hopefully reduce a lot of the pain. So funny story, but I like to do videos whenever I have a procedure like this done, just to talk about it, especially because I know that some people with EDS are very skeptical of surgery, and there's a lot of anxiety when you have a chronic illness with medical procedures like this, because you worry, is it going to actually help or is it going to increase your pain? Do the doctors know what they're doing? Do they know how to treat you? And I myself dealt with that and was afraid of having surgery done for a long, long time. But I'm really hoping that this one will be successful and that it will help. And I think that as long as your doctor is confident that you're doing the right thing for you, and that you've done your research and you know that what the surgery is, and you agree that it's something that you need and that will help you, then I think there's nothing to worry about. I think it's make sure your doctors are aware of any special needs that you have. And anything else, like for example with EDS, we have some issues with anesthetic. So my doctor is aware of that, and he knows that I might need more anesthetic, and that there's a higher risk of me waking up or something during surgery, so that way they can know that, and they can plan ahead so that if something happens, they can fix whatever goes on. So hopefully everything will go well. I'm a little bit nervous, but also at the same time, I'm just really looking forward to just getting it over with. So I've been trying to avoid the surgery for about 2 or 3 years now. And for about the past year, I've been pretty much resigned to the fact that it's going to happen. And I've tried everything you can think of to try to avoid the surgery. I've done physical therapy, I've done alternative treatments, I've done massage therapy, I've done stretches, medications, anything you can think of to try to fix the knee, I've tried, except for this. So, I talked about it with my doctor, and he thinks that the risk for me, even though I do have EDS, he says that it's a very low risk because my knees aren't particularly hypermobile, at least not side to side. So he thinks it won't be a problem, and he thinks that it'll be good, that it'll go well, and that it'll be good. So, a funny story is that before I was going to make this video, I was like, oh yeah, I need to film this because it's the day after tomorrow. And I started to get the camera out, and then I realized, like, wait a minute, this is the shirt I wore in the last video, so I had to go change my shirt before I can make the video. So I thought that was funny. But yeah, I'm in the bed that we set up for it. So I'm at my parents' house, and this is the bed that I'll be recovering in. And we switched it because normally I use a smaller bed, but it's lower to the ground. So this is still a futon, but this one has a frame. So it's more room, so that I'll have more room, and it's also higher off the ground, so that way it should be easier for me to get it out of the bed. And both sides I can also get out of. The other one was against the wall. So this one, we made a little bit more room in here so that I can get out of either side, and I think it should be a little bit easier to maneuver because when I had my nose done, the smaller bed was fine because it was my nose and it was easy to protect both of my leg. I think the extra space will be helpful. So yeah, so I will update when when I have the surgery. Maybe I might film a little bit on the morning of and talk about it, but I am very excited to tell you guys how it goes, and hopefully I will have good progress to report, and I'll tell you guys all about it. So tune in next time.